Thank you, guys. Thank you for having me. I'm excited to be here. Maybe just a show of hands, who has participated in cardiac rehab? That's awesome. So I get the privilege to share something I'm very passionate about, and that's our field of cardiac rehab. I think cardiac rehab is such a, I'm going to use the word magical place. It's a spot that people can kind of get together with others who are going through the same health event, and it's a way to kind of collaborate, and it's a safe space to kind of set a plan and get back to the things that we want to do. So thank you guys for having me. Okay. So there's a good show of hands about cardiac rehab. I will just kind of share a little bit for those that maybe don't know. What cardiac rehab is it's a medically supervised program that your physician will typically order after certain heart events. So things like heart attack, bypass surgery, valve repair replacement, which we're kind of talking about today, heart failure. And what it is it's a program designed to individualize a patient's care, to look at their health history, look at what their goals are, what they want to get back to, and how do we kind of create that plan for patients in a multidisciplinary team. So Sarah kind of talked about this too, but it's how do we have communication from cardiac rehab staff, physicians, dietitians, pharmacists, to help kind of look at the whole patient and see where they are, see where they want to be, and how do we help get them there. So this picture is few years old, but I just wanted to highlight our Sanford Fargo cardiac rehab team. This was during COVID, so we need to do a new picture now with our masks. But we have a fantastic team, and I think what you'll find, if you guys have been in other cardiac rehab centers or sites, that the staff that work in cardiac rehab are a special group. They're there because they care about the health and well-being of the patient, and we have a fantastic team. I'm going to highlight too, one of my team members, Jess. She's here with us today. She's in the picture as well, but if you guys have any questions, we got one of the best clinical exercise physiologists in the room today. Okay, so cardiac rehab starts in the hospital. This is my friend Kurt. Typically, we'll get an order from the care team as the patient gets admitted that we want you to see cardiac rehab. So our kind of goal is to go on in as soon as it's appropriate or we're available to kind of start the cardiac rehab process. We call it phase 1. That's during the inpatient or hospital stay. So our goals for phase 1 cardiac rehab is to educate the patient, what is cardiac rehab, what is the plan set forth that we can help with. We want to start some sort of physical activity. We know research will show that in as little as 3 days of being sedentary, we start to lose significant strength, especially in our larger muscle groups, our quads and our legs. So how do we preserve and stay as strong as we can for the time that we're able to discharge and head home to not be at a deficit? Or how do we preserve, again, as much strength as possible? So range of motion in the room. Then when it's appropriate, start walking. Get up on our feet, support our body weight, start walking through the halls. We'll get some good assessment on how the body's tolerating that activity. How's the heart tolerating it? What's the color look like? Are we able to communicate, have a conversation with moving? And then again, set up that plan for post-hospitalization when we head home. What does it look like? Where do you want to be? And can we help get you scheduled for an outpatient phase 2 program? Here's my friend Cody. Again, just kind of highlighting some of the things is how do we start that process in the hospital and then move it to an outpatient cardiac rehab program? Here's my friend Randy. This is our outpatient cardiac rehab space in Fargo at our South Point Clinic. And for we call it phase 2. Really what cardiac rehab will do on that phase 2 side is we start with a one-on-one assessment. We'll take a look at your current health history, what brought you into the clinic today. We'll look at current medications. What's your appetite like? Are you able to eat? One of the big things too, depending on the surgery or the heart event that brought you into cardiac rehab, we might fine-tune some of our recommendations. After a open heart, the SAVR procedure, a lot of times your body's just trying to repair tissue, so calories are important. We'll take a look at how well you're eating. What does that nutrition look like? We'll look at risk factors like cholesterol levels, sleep. Sleep is very important when it comes to recovery. That's when your body recharges, regenerates tissue. So what does that look like? What's your pain after your event? How are you feeling? What can we do to help modify that? We'll look at things like alcohol use, tobacco use, current weight levels, activity levels. How much are you moving? How much were you moving prior? How much do you want to move? What are your goals? What do you want to get back to? Do you want to get back to playing music, drums? I heard kind of story with Pete here. Do you want to get back to playing pickleball? Lifting up kids, lifting up grandkids. We'll take a look at the heart pump efficiency. How strong is your heart? When we look at intensity levels of resuming activity, how aggressive or how conservative do we want to be with that progression? We'll look at things like resting heart rates, exercise heart rates, heart rhythms, as well as assess your blood pressure, oxygen saturation, blood sugar if applicable. So it's kind of a all-in-one inclusive, we call it an individualized treatment plan that we'll go through with that first day of cardiac rehab. With that knowledge, you'll actually then do some form of physical activity assessment. It might be a 6-minute walk. It might be getting you on doing a sub-maximal treadmill walk, maybe a bicycle test, but really just seeing how's the heart responding after your procedure? Is it responding appropriately, or is there a concern or something that we see that we might want to get back to your physician? I think of like Dr. Bajwa speaking today, Dr. Sharma, Dr. Wynn, Dr. Farkas. We'll do kind of a full-on report and say, the patient came into cardiac rehab today. We were able to walk for 15 minutes at maybe a speed of 2.0 miles per hour, maybe an incline of 1.5 degrees or grade. Based off of that activity, we'll kind of look to see how did the body respond. Was there enough oxygen kind of moved around to keep up a conversation? Are we having any unusual shortness of breath? Do we see a new rhythm that's unusual? Maybe prior to coming in, we saw in a 12 lead that baseline rhythm was normal sinus rhythm, but maybe 70, 80 beats per minute. But we put you on telemetry at rest and we say, oh, heart rate's about 120 and it looks a little irregular. Maybe it's a new onset atrial fibrillation. But again, it's finding that assessment process of where are we at, and if things just don't quite look quite right, how do we highlight that, get that back to the provider or the care team, and how can we intervene? And then setting up a plan. One of the nice things about cardiac rehab is most insurances will cover 36 sessions of therapy. So in that time, that might be 2 to 3 sessions a week, up to 3 to 4 months. We get a good idea of knowing what's normal for the patient, and then we have a good amount of time to progress with those plans to get people back to where they want to be. So it's kind of unusual. I don't think many therapies have that as much one-on-one type of care or time, opportunity with the patient to get them to where they want to be. So after that initial assessment, we'll set up those future therapy sessions, and a lot of times they're done in a class-based format. In Fargo, we run classes of 12 patients at a time. So as you come into cardiac rehab, we have an education room. Patients can kind of sit and gather, get a chance to meet each other, share their fears, their concerns, maybe their day-to-day things that are new. Say, I'm about 3 weeks out of surgery, but I'm really starting to get itchy right here around my sternum site, or showing off incision sites. This is how mine looks. Does yours look the same? It's kind of fun to see the collaboration between patients. But again, then we'll kind of head into the gym, and the goal is kind of the same when you come to cardiac rehab. It's how do we do some form of physical activity? Or maybe actually I want to step back for a second. Cardiac rehab is, it's how do we rehab your mind as well as your body? So it's kind of looking at those two aspects. So the education piece and the socialization helps with the mind, and then the physical activity helps with the body. Our goal, while there may be some differences based off of procedures that have been done and limitations, lifting restrictions, we still want to move. So it's what does that movement look like for each person? And then our goal is 36 sessions later is hopefully to have met some of those individualized goals. They might be behavioral based, trying to eat better, become more consistent with my medication management. Maybe I'm looking at trying to quit smoking. And then the big piece is going to be activity based. We look at a thing called METs, and as you share with your cardiac rehab team, hey, I want to get back to playing drums or mowing my lawn, or I have a certain lifting requirement back at work, we'll kind of set up that plan of how do we get you there, and how do you really assess the heart. When you're moving at least 10 minutes, 15 minutes, we can kind of see based off that intensity, we call it a MET level, of what is your heart tolerating, and have you met that MET level for graduation. Here's a picture of one of our patients on their graduation day, again with fantastic staff that we have. At graduation, they've either met or have felt comfortable with their current plan and goals, that they're able to continue their program outside of cardiac rehab. That can be at home, a local health club, or what we call phase 3 with our cardiac rehab program in Fargo. That's what we try to get all of our patients to. It's that independent program. Here's my friend Greg. But it's how do we get the patient back to a spot where they feel at a level that they feel comfortable doing it on their own. Kind of going back, again, one of the magical things about cardiac rehab is there can be a lot of fear or unknown about what my life is going to look like after this new heart event. So how do we kind of support that and get you to a place of saying, hey, I'm back to doing the things I want to be, and then how do you keep it up? Again, I just couldn't help but put in pictures of my cardiac rehab friends. CT, he's working inside our gym. Riaz, Mary. I have a phase 3 friend outside there. My phase 3 friend's inside as well. But just keeping up that physical activity. So that's kind of about cardiac rehab, or just the phases, the special aspect of what that program can do. But talking about recovery, what are some of I wanted to highlight, and that's what I have in these last 2 slides, things to think about on how can you recover well, or what are the things that most patients may want to know or get some support for. So kind of my first tip, remember that it takes time. It's always going to be slower than what we want. Be kind to yourself. I'll hear patients say, oh, I should have been doing this, or I can't believe I didn't do this, and that's why I'm here in cardiac rehab. And it's never one thing, and most of the time it's not your fault. It's things that we can't control, that we get frustrated about. So we kind of say, well, what are the things that we can control? And let's focus on those. The small things matter, and they add up. So just small steps each day, whether it's literally physical steps, that helps, or can the steps in our behavior change? Those make, they build up over time. Listen, we always say, listen to your body, tell others. If something feels different, doesn't seem quite right, let somebody know so we can kind of look into that. Take your medications as directed. Focus on your sleep hygiene, good quality sleep. We have education classes in cardiac rehab. You don't have to attend, but they're highly encouraged. But we have a sleep specific to sleep. We have an education class specific to sleep. I know Dr. Myers this morning talked about stress and anxiety and gratitude. We have classes specific to stress management. Know your numbers. And numbers meaning what is your current weight? And is it fluctuating? Should it fluctuate? Or when do we be concerned if it fluctuates too quickly? What is a good blood pressure number? What's your normal resting heart rate? And is that different? And if it is different, let's look into it. Why is that? Do you know your cholesterol numbers? A1C? And then technology. I know Dr. Bajwa talked about the future. Something real simple for us when it comes to physical assessment are things like smartwatches. We can see our current steps, how active we are, or if we're setting goals. How can I do a little more tomorrow than what I did today? Fuel yourself properly. Eat real foods as much as you can, a variety of colors. Make sure you get a good amount of protein. And it's okay to enjoy sweets. A lot of times people say, oh, I'm in cardiac rehab. I can't eat anything that I want to eat or that I like to eat. No food is bad, but it's how much of that food and how often and frequency, kind of sizes, moderation comes in. Again, more cardiac rehab friends I got to show off. Second set, try to do some form of activity every day. And again, small bouts of activity add up. When we start looking at a physical activity plan or an exercise plan, if it's something that you haven't been doing very regularly, we'd rather start off small with multiple bouts per day, most days out of your week. We've all been there that you go through a workout and you're stiff and sore, you wake up and you hurt. You think, oh man, I overdid it. I thought I was doing more than what I could. But usually what happens is then it's less likely to want to exercise the next day, or you might take 2 or 3 days off, where I'd rather have you work less intense, but still be able to go out for an evening walk, get back to cardiac rehab or the gym the next day. Can you pass the talk test when you exercise? So we say if you can't complete a sentence, if we come up and say, hey, let's say, Pete, you're walking on the treadmill in cardiac rehab, and I go, Pete, how's your walk going today? And you say, well, today, it's no problem. In fact, I don't think I've ever felt better. And we'll say, well, Pete, that's awesome. That's great. But you can't keep up a conversation with us, so we're probably pushing it a little too hard. You can't pass the talk test. And what that means is you're probably not going to be able to continue much longer on that treadmill before you have to stop and rest to catch your breath. So we say, can you pass the talk test? Strength training is important. When we don't feel well, we stop moving, and when we stop moving, our muscles get weaker. So it is important to add some form of stimulus to our muscles in a variety of ways. So finding an opportunity to continue to strength train, but pay attention to lifting restrictions. Make sure that that lifting is appropriate for you at that point. That's kind of where that cardiac rehab team can come in. No pain, no gain is bad advice. So if there's pain, it's your body's way of telling you something isn't quite right. So how do we modify it? It is okay to challenge yourself, and in fact, we want everybody to challenge themselves, but small challenges, small steps. And again, if it hurts, stop doing it. Make sure to hydrate. A lot of times we don't drink enough water, or substitute certain fluids that we're currently drinking for more water. Find healthy stress management techniques, meditation, getting out, going for a walk, listening to music, socializing with a friend. Get out and socialize. And just remember, it takes time. I think things like this is really important. It's a way to get people together and people on kind of similar fields, similar patients, in that we call it the psychosocial, but that mental piece is kind of so important. And how do we create opportunities to allow people to get together? Things that Amy and Pete are doing here today. This is fantastic. So thank you guys for letting me speak and be here with you today. And then again, just showing, I think the point of my last couple of slides, this is pulmonary rehab friends. It's one of my first renal rehab patients in the dialysis center. And then me as a young, I still feel kind of young, but 15 years ago in cardiac rehab. No matter what the disease process is, no matter what the heart event is, valve repair, replacement, heart failure, lungs, the rehab and recovery is always the same. It's how do we find appropriate movement and activity? How do we fuel ourselves the right way? And then how do we recover? Stress management and sleep. And those are kind of the three pillars when it comes to getting healthy. And it's just fine-tuning the specifics for each person. And then the last thing, just for a little lightheartedness, doctor asked me to spend at least 1 hour per day on the treadmill. I think they found out a good way to utilize that treadmill. So thank you guys.